Okay, let's go now with myocarditis. Uh, Myo means muscle, card means heart, and itis means inflammation. So, myocarditis is inflammation of the myocardium, which is the muscular middle layer of the heart wall, which contracts and relaxes so the heart can pump blood around the body. So, here you have the heart pumping. As always, here you have the lecture objectives. Let's start with, well, we already start with definition, and let's see now the etiology. In North America, viral infections, especially Coxsackie-virus B infections, are the main cause of myocarditis. Viral infections can trigger lymphocytic myocarditis, which is when lymphocytes, B and T cells of the immune system, and water make their way into the interstitial space, which is the space between the heart muscles, cells. Sorry. However, there are plenty of other infectious causes. One of these is Trypanosoma cruzi, a single-cell protozoan that causes the Chagas disease. Don't know if you heard about it. Maybe if you went to South America or Central America, you heard about this. In Chagas disease, under a microscope, it's possible to see groups of amastigotes within the heart muscle cells, which these are the trypanosomes that are in the intracellular stage. As a result, the heart muscle cells necrose or die, and this infection may be latent in many people. So, for instance, when you go to donate blood, at least in Spain, they will ask you if you ever lived in Central or South America. And if you did, you'll have to go through a test to verify whether you are free of the disease. Also, there is Trichinella, a round worm that moves from the intestines into various parts of the body, causing a variety of problems, including myocarditis. This disease can also be seen in Lyme disease, which is caused by the bacteria Borrelia burgdorferi, which is spread by deer ticks. Here you have an image of that disgusting animal. And finally, in immunocompromised individuals, there's Toxoplasma gondii, a single-cell parasite harbored by cats that can cause also myocarditis. And those were the infectious causes, but there are also non-infectious causes of myocarditis. These include systemic lupus erythematosus. We went through that disease also known as lupus, and polymyositis, which is a generalized inflammation of the muscles, where the immune system starts to attack myocardial layer of the heart. Also, there are drug-associated myocarditis, which means there is an adverse drug reaction that inflames the heart. Drug reactions cause an hypersensitivity myocarditis, which is when eosinophils get into the blood vessels of the myocardium. Finally, there's giant cells myocarditis, which causes inflammation in the heart. The cause is unknown, and the key finding here is that macrophages, that are the immune cells that are unspecific, that engulf any foreign substance, start to fuse together and form a single giant cell. But whatever the original infection, inflammation in the myocardium layer causes swelling, and this damages the heart muscle cells' ability to contract, and also to the conductivity of those cells. That means that less blood gets pumped out of the heart with every beat, and if myocarditis is severe enough, it can lead to heart failure, which is when the heart can't keep up with the demands of the body. Once the inflammation resolves, the heart contraction typically returns to normal, but occasionally, when the inflammation is really severe, it can cause fibrosis, which is that scar tissue forms in the myocardium, and scar tissue doesn't contract normally, it doesn't conduct normally, so it happens that it causes long-term problems with heart contraction. So, because of all this, individuals with myocarditis can have chest pain that is sometimes positional. That means that it gets better or worse depending on the body position, like lying down or sitting. It can also cause arrhythmias or irregular heartbeats because the inflammation affects the pacemaker cells that travel through the myocardium. There can be also more general symptoms like fatigue, fever, shortness of breath, and in severe cases where myocarditis starts to develop into heart failure, there can be additional symptoms like fluid retention in the feet and ankles. That's called pitting edema. Individuals with myocarditis suffer heart muscle damage, which causes troponin and creatinine kinase levels to rise in a blood test. Also, in an electrocardiogram, it can be seen the sinus tachycardia, which is a heart rate which is accelerated, as well as a T-wave inversion, also called saddle-shaped T-wave, because the ST segment elevations look like a horse saddle. Also, in a X-ray of the chest, you may find enlarged heart, while in an echography will show the inflammation of the heart wall. And ultimately, the diagnosis is based on a biopsy of the cardiac muscle, but as you will understand, this procedure comes with some risk and is not always done. About the treatment, the treatment of myocarditis depends on the underlying cause. So if it's a viral myocarditis, it will usually improve slowly over time, and other infections will be treated with the appropriate antibiotic. If there are signs of heart failure, then they are typically managed with medication and careful fluid balance and electrolyte balance. Arrhythmias usually resolve as the inflammation improves. And finally, in severe cases, like some cases of Chaga myocarditis and giant cell myocarditis, a heart transplant can be needed if other treatments doesn't work. And that was all for myocarditis. Thank you for listening.
That's all, folks.